Hi! My name is Raniela Andre Maxine Y. Cabaya.
And I'm Nicole K. Aldolor, and today, we will be demonstrating essential postpartum monitoring skills that every nurse needs to know.
Postpartum monitoring is crucial for ensuring the mother's well-being after childbirth. We will cover vital signs, fundal checks, logia monitoring, and more to provide the best care possible for the mothers.
One of the primary reasons for close observation is the prevention of postpartum hemorrhage, a potentially life-threatening condition caused by excessive bleeding after delivery. Regular monitoring of vital signs, uterine tone, and the amount of vaginal bleeding helps detect early signs of hemorrhage, allowing for prompt medical intervention. Additionally, postpartum monitoring is essential for identifying infections such as endometritis or urinary tract infections, which are more likely to occur during this period.
Today, we will also walk through the bubble assessment, which helps nurses monitor and support a mother's recovery after childbirth. This assessment covers the breasts, uterus, bladder, bowels, lochia, legs, episiotomy, and emotions. Before we begin, remember that patient safety is the priority. Always perform hand hygiene, wear gloves before touching the patient, and ensure to maintain their privacy by pulling the curtain. Introduce yourself to the patient, confirm the patient's identity, and explain the procedure so that they feel comfortable and informed.
After introducing yourself, confirming the patient's identity, and explaining the procedure to the patient, we'll start our postpartum assessment by first checking the vital signs such as blood pressure, pulse, temperature, respiratory rate, and oxygen saturation. It's essential to monitor these regularly to detect any complications such as postpartum hemorrhage or preeclampsia. For instance, if a mother's blood pressure is elevated, it could be a sign of postpartum preeclampsia, which requires immediate attention. Tracking the pulse and respiratory rate can help identify signs of infection, hemorrhage, or cardiovascular issues. Temperature monitoring is important for spotting infections like endometritis or other postpartum infections. Consistent vital sign checks ensure any emerging problems are addressed quickly, promoting a safe recovery for the mother.
Now, we will use the bubble technique. We will explain to the patient each step as we go and ask her to let us know if she feels any discomfort. Ma'am, I will be assessing your breasts. Are you experiencing any tenderness, lumps, or soreness?
They're a little sore, especially when breastfeeding.
I am now going to gently feel your breasts. Mild soreness is normal, especially when breastfeeding. But if you notice severe pain, redness, or lumps, it could be a sign of infection. It is important to breastfeed frequently to prevent engorgement and keep your milk flowing. This step is important for evaluating breastfeeding success and preventing complications such as mastitis or breast infection and engorgement or painful swelling. By assessing for tenderness, lumps, or redness, the nurse can detect early signs of infection or inadequate breastfeeding techniques.
Ma'am, I'll check your uterus. This helps ensure that it's contracting properly to prevent excessive bleeding. This step ensures that the uterus is contracting properly to prevent postpartum hemorrhage, which is one of the leading causes of maternal morbidity and mortality. A firm and well-contracted uterus reduces bleeding, while a soft or buggy uterus indicates uterine atony, increasing the risk of excessive blood loss. Fundal massage or other interventions can help promote contraction and control bleeding.
Ma'am, have you been able to urinate without any problems?
Yes, but I've been going more frequently than usual.
Frequent urination is common after birth because your body is eliminating extra fluids from pregnancy. However, it is important to empty your bladder regularly because it can interfere with uterine contraction, potentially leading to postpartum hemorrhage. Monitoring bladder function ensures the mother is voiding regularly and comfortably. Encouraging frequent urination is crucial for postpartum recovery and preventing complications such as urinary tract infections.
Ma'am, have you had any bowel movement since giving birth?
Not yet. I've been a little worried about the pain.
It's common to feel hesitant, but it's important to have regular bowel movements to prevent constipation. Drinking plenty of water, eating fiber-rich foods, and moving around can help. After childbirth, bowel function may be slowed due to the effects of anesthesia, immobility, or fear of pain from perineal trauma. Assessing bowel movements helps prevent constipation, which can cause discomfort, hemorrhoids, or additional perineal pain. Regular bowel movements ensure that the gastrointestinal system is functioning properly and contribute to overall postpartum well-being.
Ma'am, I'll check your diaper to assess for bleeding. Have you noticed how much you've been bleeding?
It's been lighter than right after birth, but it's still there.
Lochia is expected after birth, but it should gradually decrease in volume and change color from bright red to pink or brown. If you notice heavy bleeding or large clots, it is important to let us know right away. The different types of lochia serve as indicators of the body's healing process after childbirth. Lochia rubra is the bright red discharge in the first 3 to 4 days, which is normal. However, if it is excessive or contains large clots, it may indicate postpartum hemorrhage. Lochia serosa is the pink or brownish discharge around day 4 to 10. If lochia rubra persists or reappears during this period, it could indicate delayed uterine involution or an infection. Lochia alba is the yellowish white discharge around day 10 up to 6 weeks postpartum. This indicates healthy healing. If it has foul odor or is accompanied by fever, it may signal an infection. Excessive bleeding, foul odor, or large clots may indicate retained placental tissue, infection, or other complications.
Ma'am, I'll check your legs for any signs of swelling or tenderness. Are you feeling any discomfort in your calves?
No, they feel fine.
It's important to monitor for signs of deep vein thrombosis, which can cause swelling or pain in the legs. Moving around and stretching your legs can help prevent blood clots. Postpartum women are at an increased risk of developing deep vein thrombosis due to hormonal changes and immobility during recovery. Assessing the legs for signs of swelling, redness, or tenderness helps detect potential blood clots early. Preventing DVT through early detection and encouraging mobility is essential, as untreated DVT can lead to life-threatening pulmonary embolism.
Did you have episiotomy? If yes, I'll check the healing in your perineum. Are you feeling any pain?
It's sore, but not too bad.
It's crucial to assess the healing process to prevent infection or complications by checking for signs of proper wound healing, infection, such as redness, swelling, or discharge, or hematoma formation. The nurse ensures that the mother's perineal area is recovering. Proper hygiene, pain relief, and wound care contribute to faster healing and reduce discomfort. Everything looks good. You can use ice packs to help with healing and discomfort. If you notice any signs of infection, like increased pain, swelling, or discharge, let us know right away.
Lastly, I just want to ask how you've been feeling emotionally. Have you been feeling overwhelmed or sad at times?
A little. It's been a big change, and I'm just trying to adjust.
That's completely normal. Many mothers experience what we call the baby blues, but if you ever feel persistently sad, anxious, or overwhelmed, it's important to talk to someone. We're here to help you with both your physical and emotional recovery. Postpartum emotional assessment is vital for detecting signs of mood disorders such as postpartum depression or anxiety. Many women experience baby blues due to hormonal shifts, sleep deprivation, and the emotional demands of caring for a newborn. Assessing emotions helps identify mothers who may need additional support or resources for mental health. Early intervention can prevent more severe conditions like postpartum depression, which can affect the mother's well-being and her ability to care for her baby.
And that concludes our bubble postpartum assessment. By monitoring the breasts, uterus, bladder, bowels, lochia, legs, episiotomy, and emotions, we ensure that mothers are recovering safely, comfortably, and holistically after childbirth.
Remember, postpartum care isn't just about physical healing. It's also about supporting emotional well-being and recognizing when extra help might be needed. As nurses, our role extends beyond medical checks. We're here to guide, educate, and reassure mothers through this transformative time.
So, whether you're a nurse, an experienced professional, or even a new mother, knowing how to perform a thorough postpartum assessment is the key to promoting healthy recovery. Together, we can make a difference in the lives of mothers and their babies, ensuring their post-birth experience is as safe and positive as possible.
Thank you for watching our tutorial on postpartum monitoring. Always remember, a healthy mom means a healthy baby. Keep learning, keep caring, and let's continue providing the best care possible for every mother.